Management of black, white, yellow fungal infections in COVID survivors. Fungal infections are common complications of viral pneumonia, particularly in critically ill patients. These infections increase the need for intensive care. With rising COVID cases in India, the number of fungal infections are also increasing, contributing to the increased mortality. The fungal infection reported in some COVID survivors is mucormycosis. Mucormycosis is a rare fungal infection caused by a group of molds called Mucormycetes. People can acquire this infection by coming in contact with the fungal spores in the environment. This infection occurs in individuals who have health problems like diabetes or who take medicines that lower the immunity. Black, yellow, white fungal infections are types of mucormycosis, which differ in the part of the body the infection occurs and the symptoms presented. The symptoms of rhino-orbitocerebral mucormycosis are mentioned here. The symptoms of pulmonary mucormycosis are mentioned here. Good glycemic control during COVID-19 infection, as poorly controlled diabetes is the major issue for development of fungal infections. If the patient is still on steroids, reduce dosage, with aim of discontinuation. Discontinue other immunomodulating drugs, if the patient is taking any. Surgical debridement should be performed if the infection is extensive to remove all necrotic material. If the eye is involved, exenteration of eye is required, and in pulmonary, if the lesion is localized or in one lobe, surgical intervention is needed. For medical treatment, insert peripherally inserted central catheter or central venous catheter. Maintain adequate systemic hydration, infuse normal saline intravenously before amphotericin B infusion. Antifungal therapy. Liposomal amphotericin B is the preferred antifungal drug. If liposomal amphotericin B is not available or not suitable for the patient, amphotericin B deoxycholate can be given. After 3 to 6 weeks of amphotericin B therapy, consolidation therapy should be given for 3 to 6 months. The alternative agents include posaconazole or isavuconazole. Their dosage recommendations are mentioned here. Renal function and potassium level must be monitored while treating with amphotericin B. Monitor the patients clinically and with radio imaging for response and to detect disease progression. Here are some preventive measures that can be taken by the doctors and advised to the patients to reduce the incidence of mucormycosis.